For the frontal, we start at the origin is the galea aponeurosis. And at the top of your head, covering the top of your head, is this sheath, a connective tissue sheath that's like a skull cap over the top of the calvarium, and it kind of floats. Your hair kind of sits on top of it. Some people can make their hair move back and forth by moving their eyebrows. They can move the whole top of their head. That's by contracting and relaxing the frontalis and the counterpart, the occipitalis. So when we look at this, we have a lot of control over the frontal. It inserts then on the skin of the eyebrows. So you can lift your eyebrows up using your frontalis. It elevates the eyebrows and makes sure that you can, it's also the area where you get wrinkles across your forehead. Nerve, I'm not too concerned that you remember the nerves as much as the reason I put these in there is when we get into the nervous system, there'll be some questions on a lab that you'll need to know those. So that's where I put the nerve sources in. And nerve for the practicals?
Like, I mean, for this muscle practical, do they have to know nerve?
Nope.
Okay.
Nope, we haven't studied the nerves yet, so we're not going to have them do that. The occipitalis is in the back of the head. It's in the posterior aspect over the top of the occipital bone. So it originates at the superior nuchal line. That's where the EOP is, external occipital protuberance, right at the superior nuchal line. It inserts then on the galea aponeurosis, that skull cap. And then it pulls the scalp backwards. So when the frontalis contracts, the occipitalis has to relax. When the occipitalis contracts, the frontalis has to relax. It's part of the epigastric epicranius muscle group. Bicularis oris. This is a muscle around your lips. Skin and the fascia of the lips, an area around your lips this is where it attaches. And it inserts on the skin and fascia of the lips. So it's basically your lips, is your bicularis oris. Oris is opening. Oculi is eyes. We'll talk about those in a little bit. But it purses, this is your kissing muscle. So if you want to kiss or whistle, you use your bicularis oris. And it's fed by the buccal branch of the facial nerve. These are cranial nerves that come off this, those little holes in your head that we studied, right? That's where those come off. Zygomaticus major. Sounds like the zygomaticus bone to me, right? So we have the origin is on the upper lateral surface of the zygomatic bone. Upper lateral surface. That's on the cheek. And it comes down and it inserts on the skin of the angle of the mouth. So it's making a movement from your zygomatic, pulling your cheek upward, pulling your corner of your mouth upward. So your cheek gets thicker, your mouth goes up. This is your smiling muscle. Zygomaticus major, a smiling muscle. The zygomatic and buccal branches of the facial nerve. Again, another cranial nerve that comes out of those openings. And we'll talk about those openings when we talk about the cranial nerves. Levator labii superioris. So let's break this down. Levator elevates. Labii, or lips, superioris. Elevates things superiorly. So levator labii superius lifts the lips superiorly. So it originates on the inferior margin of the orbit, right about the area where your infraorbital foramen is, right in that area. And then it inserts on the skin of the upper lip. So this gives you the sneer, so you can lift your lip up. Making funny faces by doing that. The buccal nerve of the facial nerve again. Buccal branch of the facial nerve. Depressor labii inferioris. Again, break it down. Depressor depresses. Labii is lip. Inferioris it depresses it inferiorly. So it originates on the anterior surface of the mandible, right next to the menton. Mandibular symphysis, remember, it's right off to the side of that, and it's going to pull from the skin of the lower lip downward. So this is your frowning muscle, one of your frowning muscles. It takes more muscles to frown than it does to smile, right? Buccinator, or buccinator, some people say it both ways. Originates on the pterygomandibular raphe, right on the edge of the mandible, lateral to the molar teeth on the bottom, and it goes up over the top of your teeth and inserts on the angle of the mouth, the lateral portion of the upper lower lips. It pulls the corner of the mouth laterally and presses your food against your teeth. This is what keeps you from your food sloshing around on the outside of your teeth. This is also called the trumpeter's muscle. It makes it so that you can trumpet, you can play the trumpet. Pop your cheek out, it makes more pressure so you can play the trumpet or baritone or whatever you want to do. Okay. Buccal nerves, so that's about it for that one. Depressor anguli oris brings the corners of your mouth down, another frowning muscle. It originates on the oblique line of the mandible, right at the very bottom, again, right by the menton. And it inserts on the angle of the mouth, and it pulls the mouth downward on both sides. Marginal mandibular and buccal branches of the facial nerve. So a lot of these muscles that are invaded by the facial nerve are the ones that the ophthalmic branch is one that they put the novocaine in when you get your teeth done. So when you go in, they'll go in the back of your mouth and they'll put a shot in there. That numbs that nerve so that there's no impulses going from your mouth to your brain. And that's what that's why when you come out, you're drooling all over the place and you can't hardly talk, because those muscles are being also kind of paralyzed almost. Levator anguli oris. Elevates, levator, anguli, corner of the mouth, oris is the mouth. So it lifts the corners of the mouth. So it originates in the canine fossa of the maxilla. And we didn't have that on our list, but it's, if you go to the fossa, to your maxilla, there's this little indentation. You can feel a bump where your canine is, and right next to that is where that canine fossa is. It inserts on the angles of the corner of the mouth, and it elevates the corners of your mouth. Another smiling muscle. Helps you bring that smile up. The nerve is the buccal branch of the facial nerve. A lot of muscles are innervated by the facial nerve. The mentalis muscle, tiny little muscle, originates on the anterior surface of the mandible near the mental symphysis, a little bit closer than the other depressor ones we looked at. And it elevates the skin of the chin. Pulls the skin of your chin up. If it's really contracted, you get kind of a, call it a butt chin, if you will. Right? The nerve is the marginal mandibular branch of the facial nerve. Don't worry about the artery. I should have took that off there. Usually I make people remember the arteries too, but not this time. The mentalis has two direct actions that helps with this. So you can pull the lip down if you contract it in the right direction, or you can pull the tissue up of the chin. So it does both in conjunction with other muscles. How we do it? Am I going too fast? Too slow, right? Platysma. This is a kind of a broad, flat muscle that originates in the fascia overlying the pectoralis major, which is on your chest, right in through here, your upper chest. And it inserts on the inferior border of the mandible and the skin of the lower face. So it goes up underneath here, around over the top of your chin, and inserts at your jaw. So it draws the corners of the mouth down. It aids in depression of the mandible, helps you pull your mouth open, like this. But it also has another kind of a funny action. If you lock your jaw and contract it, you can make the muscle on the top of your chest move up and down.
I've heard about the eek muscle, which helps me remember it.
Eek?
Yeah.
I call it the stripper muscle because if you lock your jaw and contract them, you can make your chest jump up and down. Like Arnold Schwarzenegger, you can boom, 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 makes them move up and down. So eek or stripper muscle, that's a good way of looking at it, right? Very broad, flat muscle. Now when you contract it, you can actually see the fibers sometimes in your neck where it contracts, especially on very thin people. The rhizoras, another little muscle. It originates on the fascia of the lateral cheek. It doesn't actually make it to a bone. It's just the fascia that's hooked to the bone in your cheek. And it inserts on the skin and the angle of the corner of your mouth. So it's pulling your cheek, the corner of your mouth almost backwards. We call it the grinning muscle. Expression of mirth. Ha ha ha, I got away with it. Ha ha ha. Buccal branches of the facial nerve again. Facial nerve is a very big branch. Orbicularis oculi. Sounds like oculi, eye, right? It's the part of that. Orbicularis means it's a circular muscle around that whole area. So the origination of this is the orbital part is around it with the medial aspect of it. And then we have the palpable part, and that is all around the eye, kind of a circular around the eye outside. And then the insertion is the skin of the lateral cheek and also the lateral palpable raphe. So it helps us to close your eye. Forcefully closes the eye. This is your winking muscle. Allows you to wink. So your flirting muscle, your winking muscle, this is your orbicularis oculi. Temporal and zygomatic branches of the facial nerve. These are the ones that go upward on the facial nerve. Masseter. This is one of the two main muscles of chewing. It originates on the zygomatic arch. Remember that, right? The zygomatic arch that comes across. From the zygomatic to what bone? What is the bones of the arch? Temporal and zygomatic, right? So it connects those two. It inserts on the lateral surface of the ramus of the angle of the jaw. So the ramus and the angle of the jaw, where it comes down right here, is where it attaches. So it goes up into the zygomatic arch and helps to pull your jaw upward in a chewing motion. Your platysmus can open up your mouth. Most of the time your mouth just drops open. We don't pull it open so much as we just let it drop by way of gravity. That's the easiest way to get your mouth open. Just relax and it just drops open. But to get it to clench shut, we have to use the masseter, and also the next one I think would be the temporalis, I believe. Yep. The temporalis originates on the temporal fossa and the temporal fascia around the temporal bone. So above the ear. So when you bite down, you can see up in here, sometimes people, their face will kind of move, especially if they're really tense and clenching their teeth. You got these bulging bumps on the side of their temporal bone. That's the temporalis contracting. It inserts on the coronoid process of the mandible and the anterior surface of the ramus of the mandibular fossa and the temporal fossa. So it's going to pull that jaw upward. So this goes right through the arch. It goes down and it fastens onto the mandible on the inside, basically, more on the inside of the masseter muscle. Another chewing muscle. The medial pterygoid. Where do we find the pterygoids at? Pterygoid process. What bone was that on? Mandible. How about the sphenoid? Right? Remember, it comes down. That's the little feet of the bat behind the teeth. That's the pterygoids. So the medial pterygoids, we have medial and lateral pterygoids. The medial one originates on the medial surface of the lateral pterygoid plate, and it inserts then on the medial surface of the ramus and the angle of the mandible. So it comes down inside your mouth and goes down into the inside of your jaw, the mandible. So it allows you to pull your jaw inward. It pulls it towards the center. This keeps the teeth grinding, helps with the grinding of the teeth. The medial pterygoid branch of the trigeminal nerves are what feeds it. The lateral pterygoid does just the opposite. This one moves the jaw outward. So the medial one pulls the jaw towards the center on one side. The lateral will pull it on the other side. Now remember, we have two sides of these muscles working at the same time. So you may not realize that you're grinding your teeth or you're grinding your food, but when you chew, you bring your mouth up and it grinds it a little bit. So you grind those little pieces of peanut or popcorn, pulverizes them. Instead of just squishing them, you grind it just a little bit and breaks it up even more by using these muscles. The medial pulls it inside, the laterals pull it outward. Same thing, okay? Subclavius. Sounds like the clavicle to me, right? And if something is sub, it's below it. So a submarine is below the water. A subway is below ground. So a subclavicle would be below this clavicle. Originates on the first rib and its cartilage. So the first rib comes right here. So you got your clavicle coming over. First bump below that is your first rib. And it inserts then on the inferior surface of the clavicle. It's not a very big muscle. The subclavius nerve is what it does, but it draws the clavicle down and forward. Now, it can't bring it down too far. It's pretty little, but what it does is more of a stabilizing muscle. It helps to hold your shoulders in place so they don't go flying backwards. They help hold your clavicle in place so it doesn't go up. It also helps protect the subclavian vessels, the artery that's underneath, and if we break our clavicle, that becomes a problem. It can go right through that, cut your artery or your vein, and you can die very quickly if this little muscle wasn't there to protect you a little bit. Pectoralis major. This is the one where you do your bench presses. So it's a broad contact. It goes clear across the chest. From the clavicle all the way down along your sternum, clear down to the bottom of your, almost to where your ribs start to taper off. So origin is the medial one half of the clavicle, the manubrium, in the body of the sternum. Remember those parts, right? manubrium's at the top. The body is in the center of the sternum. Cartilages of ribs 2 through 6, clear down to the 6th rib, and sometimes the sheath of the upper abdominal wall. It inserts on the crest of the greater tubercle of the humerus. Okay, the greater tubercle, remember you have 2 tubercles. You have the lesser and greater tubercle on the humerus, and in between is what? What's in between those 2 tubercles? Intertubercular groove, right? Or bicipital groove. So this helps to flex and adduct the arm. Also immediately rotates the arm. So when you do a bench press, you're working the pectoralis major muscle. It gets big and strong. The nerve is the medial lateral pectoral nerves. Sometimes we use this to look for breast disease too. If the surface should not be fused to the fascia of the mammary gland, that can indicate that there's breast cancer present underneath it, pushing the fascia apart. Also, this comes into play with breast implants too. You have to work around the pectoralis major to make sure that they have them properly positioned. Serratus anterior, or some books call it the serratus anticus. That's the old term. This is more towards the back of the body. It originates in the posterior ribs 1 through 8 or 9 in some cases. And then it inserts on the medial border of the scapula on its costal surface, on the inside surface of the scapula. All right. Its action is to draw the scapulas towards the body, and it also helps to rotate the scapula superiorly, upward, an upward motion.
Would that raise your shoulders?
Raise your shoulders? Yes, to a certain degree. Helps to bring them up a little bit this way. What it does in adults is a little bit different than in children. You ever see a little kid where they put their arms behind them and their shoulder blades just stick out? Their scapulas just stick out? They call them winged scapulas, or angel wings, some of them call them. Some little kids aren't angels, so we can't call them always that. So they push them out. But that's because the serratus anticus is too weak, and it won't hold the scapulas against the rib cage. When they get stronger, they get older, those shoulder blades push up against the rib cage, and they become a stabilizing muscle for the shoulder girdle itself, pectoral girdle. So the winging of the scapula can be a situation that you want to look at if it persists, but a lot of times it's just weakened muscles. Trapezius, the traps. The origin is the medial third of the superior nuchal line. That's up there on top, right? Up by the external occipital protuberance. It goes all the way down then to the ligamentum nuchae, to the spinous processes of C7 through T12. Goes all the way down your spine. Then it inserts, it comes up in a triangle shape, and it inserts on the lateral third of the clavicle, the medial side of the acromion, and the upper crest of the scapular spine. So this is your shoulder shrugs. You see the bodybuilders will have a big bump on the top of their shoulders. That's the trapezius muscle. What kind of exercise would you do to strengthen that, make it stronger?
Bend over rows.
Bend over rows? Yeah, I could do a little bit. That would help. What else? It elevates and depresses the scapula. How about pull downs? Or pull-ups? They'll make this work really well. It's trapezius shaped. It's named after the shape. It's not square. It's like two triangles put together. A trapezoid shaped. And the spinal accessory nerve is the nerve that works the cranial nerve of that. Pectoralis minor is the kind of the counterpart or the helper of the pectoralis major. It originates on ribs 3 through 5, and it inserts then on the coracoid process of the scapula. If you go up and you find the coracoid, you can trace this muscle down towards the ribs, and sometimes it's tender. It becomes more of a tender area for a lot of people. It draws the scapula forward, medially rotates it, and downward. It's a stabilizing muscle more than anything. Levator scapulae elevates the scapula. Pretty simple, right? The names really are easy to learn. You just have to take that name and break it down into something that you know. So you know what the scapula is, and you know it has to elevate the scapula, so then you have to look at, okay, what is the origin of it? The origin is the transverse processes of C1, first cervical, through the fourth cervical. What's the first cervical called? What's the name for the first cervical? Atlas? Atlas, right? See, that's why you need to know the bones, so you can know where these muscles go. If you don't know the bones, if you haven't mastered the bones, you'll never figure out where these muscles are attaching, because you don't know where they're at. Insertion is the medial border of the scapula from the superior angle to the spine. Okay, remember the superior angle comes up in a point. Right below this is where it attaches, so it's going to elevate the scapula and rotate it inward as it does. So this is going to help you shrug your shoulders. Elevator, levator, scapulae. And that's what it does. It just elevates the scapula. Rhomboideus major, there's a major and a minor. And these are named again after their shape. Rhomboid shaped. The origin is the spines of vertebrae T through T5, and inserts on the medial border of the scapula. So it's going to rotate the scapulas inward. So when you do like rows, bent over rows, or any type of where you pull your scapulas together, you're working the rhomboid muscles, the major and minors. So it's going to retract, pull your scapulas back, and slightly elevate them. When you put them all together, they look pretty impressive when you start working them. It makes them stronger. Rhomboideus minor, just a little bit higher than the major. Inferior part of C7 through T1. The major was below that. Insertion is the medial border of the scapula and the spine of the scapula. So remember where the spine of the scapula is? It goes clear across the top, right? It's that big bump, that big ridge. Elevates, retracts, and rotates the scapula inferiorly. It's so high up there that it's also going to rotate it a little bit towards the bottom. Psoas major. Psoas major. This is one that originates in the bodies and the transverse process of the lumbar vertebrae. This attaches to the sides of your vertebrae and those little transverse processes that stick out of the side, and inserts on the lesser trochanter of the femur. So it's kind of in the back, but it goes through to the femur, and it effectively flexes the thigh. It brings your thigh upward, laterally bends the lumbar vertebrae column. The psoas major, psoas minor, and iliopsoas muscle are the ones that you can affect if you cross your legs. How many people cross your legs when you sit?
Yeah.
Okay. Is that a good thing? No. Crossing your legs is hard on your back and it'll throw you out of place really, really fast. So we can do a demonstration on that. If someone wants to be a guinea pig, I can show you how that works. You want to do it? Come on up. Give you a little break from.
Yeah, I wrote a schedule for Tuesday, but I mean, you can always help me out.
Sit right here facing that way. Okay, so let's have your arm up like this. I'm going to push down. We're going to see how strong your body is. Don't let push down. You go right against. Good. Now you cross your legs for me.
Cross my legs.
Cross your legs.
Oh.
Pitiful. Just kidding. I'll hold this up. Yeah. Can you?
Alright.
Now keep them uncrossed.
Alright, keep them on cross.
Now hold it up. See, it's still weak. Still weak. So I want you just to rub right here in your tummy, right?
Alright, right here, right there.
Yep. Rub really good in there.
Alright.
Okay. Arm up. Hold that up again. Now he's really strong. So if I make him cross his legs again, he'll go weak again because his body, one side of his body is strong, the other side has been stretched out of place. Just a little bit even makes a difference. So this muscle, you put your arm down, goes from your back all the way down kind of through this area and attaches on the lesser trochanter. So when you bring your leg over, it stretches one side and the other side is not stretched. And it causes an imbalance in the spine. And people ask me, well, how come my hips keep going out? You cross your legs? Well, yeah, way to go. Every time you cross your legs, you have one side's weak, the other side is strong. So what you have to do is you have to cross the other leg over the top to make them both balanced. Both imbalanced. Again, sit down. Yes?
Does it make a difference if you cross at the knee or at the ankles?
Ankles are fine. Knees are no good.
What about how guys do it? Or, well, most guys, how they do this? Same thing?
Yep.
I'm not sure Alex puts his foot all the way up here.
Yeah. Not good either way. So make sure that you, if you cross one leg for a while, you have to cross them the other way and balance it out. Otherwise, you'll have to come in to see your chiropractor. So as minor, it's a little bit different, but they run together. Origin is on the bodies of T12 through L1, and inserts on the iliopubic eminence. Iliopubic eminence and the line of the junction of the ilium and the superior pubic ramus. So that's the iliac spine that we talked about, right? It attaches there. It flexes and laterally bends the lumbar vertebrae and column. So if you want to work these muscles and get them strong, you do leg lifts. You do leg lifts. When we were in football years ago, we would do leg lifts. We'd lift our legs, then we'd spread them as wide as we could, and then bring them back together, and then down. Well, I didn't like to put them back down, so I just kept them up. And I guess I don't know if I was lazy or just wanted to get my muscles stronger, but you can get used to that, and that really makes your back really strong when you get these muscles good, because it's affecting those muscles of the lower back. But what happens is, it says on here, absent in 40% of the cases. These muscle fibers all fuse together, so you really can't decide whether one's one way or the other. They just all run together. So they usually call that the iliopsoas muscle. Iliopsoas muscle. And that associates with the iliacus muscle. They all insert on the same spot. So the iliacus is an iliac fossa, that body that we talked about of the ilium. And then it inserts on, I forgot to put the insertion on there, the lesser trochanter of the femur. The same spot that the psoas muscle attaches. So it all comes off that same tendon that goes into the lesser trochanter. All called the iliopsoas muscle. All running from the same areas down. So they're all a combination, the iliacus, the psoas major muscles, all kind of flowing together and ending up on the same insertion. Gluteus maximus, this is the butte muscle, right? Its origin is on the posterior gluteal line. Remember that on the iliac crest, right? We had 3 different lines. It goes down the surface of the sacrum, down to the coccyx, the sacrotuberous ligament, all the way down to the bottom is where we run, kind of the back of the leg almost. The upper fibers, the iliotibial tract, and it inserts on the gluteal tuberosity of the femur. So we didn't have that one on our list so much, but it's right posterior to the greater trochanter. Extends the thigh and laterally rotates the femur. Laterally rotates your femur outward. This is the site where most people get their shots. They'll tell you to bend over and they'll give you a shot. But they don't do this to babies. Why? They don't give baby shots in their butt. They don't have much muscle in their booty yet? Part of it is such a small little muscle at that point when they're little like that, and the sciatic nerve runs right underneath of it. So if you miss where you're supposed to be and you hit that sciatic nerve, you can make their leg go bad. You could cause them to not be able to use their leg. So you don't do shots in babies. You wait for adults when they have these big muscles. Okay, and you can hit it anywhere you want. You're not going to hit the sciatic nerve because there's too much muscle or fat there to worry about it. Okay, so where do they give baby shots at? What muscle is in the arm? Haven't come to it yet, but anybody know?
Your bicep, brachii, your deltoid.
Deltoid. There you go. Deltoid muscle. We'll get to that in a minute. Gluteus medius. Okay, a little smaller muscle than the gluteus maximus. That's why they call it medius, of course, right? Originates on the external surface of the ilium, inserts on the greater trochanter of the femur. So it abducts the femur. It pulls your legs open, spreads them, and immediately rotates the thigh. Immediately rotates it. The maximus rotates it outward. The minimus rotates it inward. It's kind of a counter movement there. The gluteus minimus, another little muscle, smaller yet, originates on the external surface of the ilium between the anterior and inferior gluteal lines, and it inserts on the greater trochanter of the femur. Just like the minimus, the medius, both are on the greater trochanter. It abducts the femur and immediately rotates the thigh. Look at it this way. Your maximus is so big and so strong that we have to have 2 little muscles basically to offset that strength. The minimus and the medius do just the opposite of what the maximus does. Tensor fasciae latae. This isn't something that you get at Starbucks. This is a muscle that is kind of a small muscle, but it has a really long tendon. I call it a fascia, which is basically a tendon. When you look at it. Originates on the anterior part of the iliac crest and the anterior superior iliac spine. Does anybody remember that? Anterior superior iliac spine. Where's that at? Right here in the front. Anterior superior iliac spine. Right underneath your belt. Helps hold your pants up.
So is that the hip bone?
That's the beginning of the hip bone. Yep, in the front. Insertion is the iliotibial tract. which courses down the leg and attaches below the knee. Big, long tract of connective tissue. It flexes, abducts, and medially rotates the thigh. This one's really cool because if you have an upset stomach, this can also hurt. Or if this hurts, you can have an upset stomach. Those are related to those. Yeah. When I find people have a hip problem, they usually have tenderness down that whole length of the iliotibial tract, and the tensor fasciolata is all contracted like this, trying to hold their body into place on the opposite side of where their hip is out of place. So it flexes, abducts, and medially rotates the thigh. It helps to reduce the gluteus maximus again, just like the others. Adductor longus. If you have a longus, we probably have a short one. Right? Adductor longus originates on the medial portion of the superior pubic ramus, pubic bone, and it goes all the way down, and it adducts and inserts then on the linea aspera of the femur, clear down towards the adductor tubercle, right above the condyles of the femur. There are more than this, though. We have the magnus, which is another one. Originates on the ischial pubic ramus and the ischial tuberosity, that's the butt bone, and inserts then on the linea aspera of the femur all the way down to the adductor tubercle, and it adducts and flexes and immediately rotates the leg. Susan Summers was one that really worked with this. It had the thigh master. You could do crunches with your thighs. It's supposed to make your thighs thinner and stronger. She made millions and millions of dollars on those babies. They're probably still out there somewhere. You still have one? They're still there. You couldn't break them, I don't think.
No, I asked kids who tried, like, used to do when there are.
Yeah. Adductor brevis is just a smaller, shorter one at the very top. So we got brevis, longus, and magnus. Really strong muscles. This helps you hold yourself on a horse. These are the muscles that clamp down on the horse to make sure that you don't fall off. Right? Adducts, flexes, and immediately rotates the femur. But they all insert on that really thin line on that femur. Piriformis muscle originates on the anterior surface of the sacrum, inserts on the superior border of the greater trochanter of the femur, and it immediately rotates and abducts the thigh. This is also one that the sciatic nerve runs right underneath. You can see this green is the sciatic nerve. If this muscle goes into spasm, it crunches the sciatic nerve and gives you sciatica, an artificial sciatic pain. You can have sciatica from your back being out of place, or you can have it from this nerve being too contracted and it'll squish down on this. I've had people that have had sciatica for years, and it's just because the way they sit, the way this muscle is contracted, we get rid of that problem and it goes away. No, they don't need a disc problem or anything like that. Now, the next ones are the eye muscles. So we're going to go over these very lightly because we're going to also find these in the chapter for the special senses. So we have the rectus inferior, means that it brings your eye downward. It inserts on a common tendon in the back, and it comes down, originates on the common tendon in the back and inserts on the sclera of the eye. That's inferior. We have the rectus lateralis that moves the eye lateral. It originates on that common tendon again, and it inserts on the lateral side of the sclera of your eye, so it pulls your eye sideways. Rectus medialis pulls your eyes inward, so if you have a muscle that's too contracted, like some people have lazy eyes that doesn't move very well, those muscles are imbalanced. They're not pulling the lateralis isn't pulling the eye back, or the medialis is too strong pulling the eye inward, depending on what we have. Rectus superioris, this moves your eye upward. Common tendon again, and inserts on the sclera, the superior part of the eye. Inferior oblique muscle. This is one there's not to be confused with a muscle in your stomach, but it originates on the floor of the orbit and inserts on the sclera, the inferior surface of the eyeball. So what it does, it elevates and abducts the cornea part of the eye and rotates superior pole of the iris laterally. So we can look in different directions. Instead of just 4 different directions, we can look in many different directions, and we rotate the eye in that way. So if you're going to do this in a clinic, you have look forward towards the bridge of the nose to test the function of the eye. So you kind of make them cross their eyes to see if this muscle works. That's inferior. Now, superior oblique, it depresses and abducts the eyeball. It pulls it downward, and so we have this test that we can do also to see if we can move it downward or upward. We look down, up, different directions. We'll do that in lab also when we get to the eyes. We have a really nice nervous system lab. Next couple of them are muscles of swallowing and speech. Genioglossus. Glossus is tongue. So this one little muscle originates on the mental spine, on the inner aspect of the mental symphysis, inside your teeth, and fans out to the insert onto the tongue, the tip of the base of the tongue. So this is one that will help you to protrude the tongue and depresses the tongue in the middle. Helps you stick your tongue out. So you call this the French kissing one if you want to. Styloglossus attaches to the styloid process. What bone is the styloid process on in the head? There, you're on the right spot, but which bone is it? Temporal bone, right? Originates on the anterior side of the styloid process of the temporal bone, inserts on the posterior lateral side of the tongue. It retracts and elevates the tongue. So the genioglossus sticks your tongue out. The styloglossus pulls it back. It attaches to that styloid process in that muscles. One more and we'll quit. Styohyoid. We don't talk much about the hyoid bone because it doesn't attach to anything as far as an articulation. But it does have a lot to do with our speech and swallowing. So the stylohyoid goes from the styloid process down to the hyoid bone. It stabilizes the hyoid bone and it helps retract it. Now the hyoid bone helps us to swallow and talk. So we have to stabilize it so that we can use the muscles that are associated with that for speech and talking.
Is it easy for people to break the hyoid bone?
Hyoid bone is so high up that it doesn't usually break. Usually they hit the chin first before they hit that. Unless you'd come up underneath like a pole or something, but it would really hurt. All right, so we'll see you on Monday. We'll finish these up and we'll start the nervous system.